One of the questions I get almost daily as a pharmacist is why are my drugs so expensive? Or why is the cost of my medicine so high? And that's a really good question that doesn't exactly have an easy answer, but it's something that we should definitely talk about because there's many reasons why the cost of medicine might be so high. Oftentimes, doctors will prescribe a medication for what they think is the best choice for the disease state, and oftentimes that's true. And there's alternative medications that could be used that may not be the best medication, but are good enough that are a little bit cheaper. And oftentimes there's not alternative medications that they can use depending on what they're seeing in the patient. So doctors are choosing what they think is the best medicine. They're not exactly going through a price sheet, nor are they submitting claims to your insurance company to figure out what's the best medication for your disease state and your insurance company or supply and demand in the market. These are things that are not exactly within their realm of knowledge, and nor should it be, right? Doctors, physicians, nurse practitioners, physician's assistants, they're there to treat the disease state. I can't tell you how many times I get prescriptions for things that are either on shortage, they may not make it anymore, it might be something that was on the market, is temporarily removed from the market. And it's not because these people are bad people, they just simply don't know what's going on in the pharmaceutical markets. And that's where I tell customers that it's really important to know your pharmacist. And it's really important to ask questions. Why did my doctor prescribe this? And the reason you want to ask that question is because it opens up a conversation with the pharmacist. And allows the pharmacist to then ask questions about the patient. Say, well, tell me what we're trying to treat here, because sometimes we use certain drugs for multiple things. Okay, and let me look. What's your date of birth? How old are you? What are the other complications that could happen if we use these other particular drugs? Why did we go down this particular route? The pharmacist could also ask questions such as, what other medications have we tried? So to help you answer that question, the best thing to do is to get to know your pharmacist. If you're going to a pharmacy where you cannot speak to a pharmacist or they don't have time to talk to you, find a pharmacist who will talk to you. Oftentimes, independent pharmacies are the best way to go. What I love about information in the world of pharmacy is that it's almost always free. You can't charge a membership fee, at least not in my state, as a pharmacist to give patients information. And pharmacists really do want to make sure that patients have the right information, because giving patients the right information means they're likely to come back to you as a customer. And it shows that they're interested in what you're doing as a pharmacist, which validates what you chose as a career path, which is very, very encouraging as a professional. So, if you're wondering why your medication costs so much, the best thing to do is make sure you get to talk to a pharmacist and ask those questions. If they give you an answer such as, I don't know, maybe talk to a different pharmacist. Oftentimes, what I've learned in my experience in the corporate world is, and I won't name the big box that I worked for, but when I was at that pharmacy, I didn't get to see what was behind the price sheet. I didn't see which suppliers were providing the medication. It was one wholesaler. As an independent pharmacist, I get to choose multiple wholesalers, so I have more insight in the industry as far as what's on shortage. Oftentimes, it's a delivery issue. A weather incident, an ice storm, or hurricane happened in a certain place where things are manufactured. The supply is backed up for X days, X months. Many factors impact the availability of drugs. That is also supply and demand related. So, there's a lot of reasons why drugs might cost more, might cost less. Oftentimes, it's an insurance agreement. So, a lot of people don't realize this, but their insurance companies has contracted with what's called a pharmacy benefits manager, who's also contracted with a drug company to make sure that certain medications are on preferred list for that particular insurance group. And that's not necessarily a bad thing. Oftentimes this keeps prices low, but it keeps competitor drugs out of the equation and doesn't allow patients to know those competitive prices. And this is where patients go to websites like GoodRx to find pricing alternatives and options, but even GoodRx doesn't always tell you the full story. If you reach out to an independent pharmacy and you ask them questions like, hey, do you use alternative wholesalers? Is there a way you can get this drug cheaper than this price? I would avoid calling and saying, hey, do you take GoodRx? It's a very broad question. Most independent pharmacists, most technicians at independent pharmacies, most cashiers are just tired of hearing that question. A better and more thoughtful question would be knowing the name and strength of the medication you need and the quantity. So those three things, the name, the strength, and the quantity of what you need. So whenever someone at the pharmacy picks up the phone, you can say intelligently, this is the name of the medication I take. And if you don't know how to pronounce the name of the medication, don't be embarrassed. Just say, hey, I'd like to spell it for you. I don't exactly know how this is pronounced. The more information you can provide to whoever is on the phone at that pharmacy, the more likely they are to help you, because now they're going to be able to level with you and better understand what you need. So don't be embarrassed about not knowing the name of the medication. I always feel strange whenever I go to Starbucks because I love coffee, but I don't exactly know how to communicate what I want. And so I just say, hey, this is what I like. These are the flavors that I like. I like things that are low fat, or I'm feeling something sweet. I need a little more energy, I need a little caffeine. And usually when I go in that direction, the person behind the counter is able to give me their recommendations, their suggestions, and their knowledge. So whenever you go to the pharmacy, definitely ask questions. Is there a medication that will do the same thing that might be cheaper? Is there a way that I can get a greater supply of this medication? If I'm willing to go outside of my insurance company, can I get a better deal on this medication? Okay, when do you think this medication will be back in supply? Do you know somebody who might have it in stock? How quickly can we get it? These are all good questions to ask, and this helps impact the cost of the medication. Oftentimes, customers are looking for a specific drug and they're leaving town in 2 days. I can get the drug, but now I have to use particular channels that make sure I get that drug quicker, which costs more, and then I've got to make sure I can deliver it to that patient. So if I'm using a courier, that adds to the costs. Now, if patients tend to have longer time windows where they say, hey, I'm running out of this in 15 days, I'm running out of this in 10 days, that opens up many more channels for me to order that medication. That might be a slower delivery time, but allows a significant cost savings where we can pass that to our customers. So oftentimes the cost depends on many factors. Getting to know your pharmacist is huge. Know them on a first name basis, and even getting to know some of the support staff at a pharmacy gets you the in. If you know that every time you call and you talk to Leo and you know him on a first name basis, even if you don't know the pharmacist, Leo is going to make sure that you get the care that you need because you've treated him with respect. So get to know your pharmacist or your pharmacy staff, ask the right questions. Don't be afraid if there's something you don't know. Go into these conversations with the goal of education, and you're definitely going to succeed, and you're definitely going to save money. Take care.